Hi, this is Jenna Johnston, and I'm the epidemiologist for the Anchorage Health Department. I wanted to take some time this morning to review data related to COVID-19 in the Native Hawaiian and other Pacific Islander community within Anchorage. So I pulled all of the Anchorage COVID-19 cases as of yesterday that have race data associated with them. And so I pulled 11,078 cases. Of those cases, 600 listed Native Hawaiian or other Pacific Islander as the race. So that's 5.4% of all of our COVID cases in the municipality. Of those, 565 listed Native Hawaiian or other Pacific Islander alone, which makes it 5.1% of the sample. According to the US Census from July 2019, only 2.8% of the Anchorage population identified as Native Hawaiian or other Pacific Islander alone. This means that Native Hawaiians or other Pacific Islanders are almost twice as likely to be diagnosed with COVID as the rest of the population. So what we've done is taken a look first at cases by month and then by week. And you can see in this chart that at the beginning of the pandemic, between March and June, there were not a substantial number of cases in the Native Hawaiian and Pacific Islander population. However, in July, there was a tremendous spike in cases, and the numbers came down a bit towards September and now are heading up again. And it's a little concerning to look at this slide in that the November data is almost as high as October, but we're only halfway through the month. Looking by week, you see a similar pattern. Again, low numbers at the beginning of the pandemic, peaking in mid-July, coming down through September, and now heading up again rapidly. And again, the last week here, we only have the first 3 days of data. So I expected the count to be more than it was last week. Looking by age, the age distribution is similar among Native Hawaiian and Pacific Islanders as for the rest of the Anchorage population, in that the largest group are people between the ages of 20 and 29. The next is 30 to 39, and continuing down as we get into the older age groups. That's good from the standpoint that older individuals are at higher risk for adverse outcomes, particularly hospitalization and death. However, we find that younger adults, those in their 20s and 30s, are more likely to be mixing in the community and maybe visiting and helping elders, which again is great under normal circumstances. But right now, we need people to be particularly careful if you may have been exposed to COVID-19 to avoid being around individuals who are older or at high risk to underlying health conditions. So then I took a look at hospitalization rates and death rates. Among Native Hawaiian and Pacific Islanders, we've had 60 hospitalizations for COVID-19, which is 10% of the confirmed cases. Compared to the entire population, we've had 336 cases for a percentage of 2.7. So Native Hawaiians and Pacific Islanders are almost 4 times as likely to be hospitalized as the rest of the population. And then looking at the death rate, there have been 9 deaths identified as COVID-19 among Native Hawaiians and other Pacific Islanders. And I do want to note that sometimes there's a delay before the medical examiner determines the cause of death. So there may be additional deaths that we're not aware of associated with COVID-19. But at this point, 1.5% of confirmed cases among Native Hawaiians and other Pacific Islanders have resulted in death, compared to 0.5% in the total population. So again, in your community, people are almost 3 times more likely to die from COVID-19 as the general population. So I just wanted to share these numbers today to stress that the Native Hawaiian and Pacific Islander population has been particularly hard hit by COVID-19. And I ask you to be particularly careful to get tested if you have any symptoms or think that you might have been exposed, and to do your best to protect others within your community. Thank you.